The research article we chose to present is Telescreening Tool to Detect Aphasia in Patients with Stroke by Simone, Chiara, Kate, and Jess. The clinical question of this study asks, is the iPad-based telescreening tool Mobile Aphasia Screening Test, the MAST, a valid and reliable tool for detecting aphasia in patients with stroke compared to traditional in-person assessments? When filling out the PICO model for this research article, the population was 60 patients, 30 of which had a stroke and diagnosed aphasia, and 30 individuals who had a stroke and did not have aphasia. So there were about 25 males and 5 females, ages 21 to 77, with the aphasia diagnosis, and 22 males, 8 females, ages 21 to 79, without the aphasia diagnosis. So the intervention that we're looking at is a screening tool for stroke patients suspected of having aphasia, which is called the Mobile Aphasia Screening Test, or the MAST. When analyzing the comparison aspect of this model, the MAST was compared to the Korean version of the Western Aphasia Battery and the condensed version of that test, the KFAST. And additionally, the MAST was compared to other tests in these categories: the aphasia quotient, auditory comprehension, fluency, naming, shapes, and descriptions. They were compared to the accuracy of an aphasia diagnosis once performing a complete evaluation to see if the screening tool was accurate.
Looking at the study design, the researchers used a comparative design to evaluate the reliability and validity of a mobile aphasia screening tool. There were a total of 60 stroke patients who participated, including those with and without aphasia. The patients completed both the KFAST and the MAST, allowing researchers to directly compare results. The study evaluates whether the mobile screening tool produces results comparable to the traditional in-person screening. The statistical measures support the reliability and validity of the tests for the sample group used.
This study's results suggest that the Mobile Aphasia Screening Test, also known as the MAST, is a quick and accessible screening tool that can be used as an alternative to longer and costly assessments that require the patients to travel to a professional. The evidence in this study is strong. The MAST can predict similar results to the Korean version of the Western Aphasia Battery, also known as the KWAB, and the Korean version of the Condensed French Aphasia Screening Test, also known as the KFAST. The MAST and the KFAST had a total intra-class correlation coefficient, or ICC score, of 0.995, which demonstrates a very strong correlation between these two test results. This strong correlation shows that the MAST and the KFAST are equivalent tests and did not differ in their results during the study. The MAST and the aphasia quotient of the KWAB had an ICC score of 0.752, which demonstrates that these tools are strongly correlated as well. This ICC score is a similar number to that of the KFAST compared to the KWAB, which demonstrates that the MAST is able to anticipate the results from the KWAB equally as well as the KFAST. The overall strength of this study is moderate. The sample size within this study consists of 60 patients who have had a stroke. 30 of these patients did not have aphasia, and 30 of these patients did have a diagnosed form of aphasia. 60 participants provide strong data for this study, but the generalizability of this study's results, especially when alternative language versions of the Western Aphasia Battery and the French Aphasia Screening Test are used, may be in question. This study was designed to test the validity of the MAST by comparing it to two established and validated assessments, the KWAB and the KFAST. Both research assistants and trained speech-language pathologists scored the results of the aphasia tools. The inter-rater reliability was very strong with an ICC score of 0.999. The outcome of this study demonstrated that when the KFAST was compared to the MAST, the comparison was very strong. It also demonstrated that when the KWAB was compared to the MAST, the comparison was strong. The MAST consistently predicted scores of patients on the KWAB and the KFAST, which demonstrates its effectiveness as a screening tool for aphasia.
From a clinical expertise perspective, this study emphasizes the need for clinicians to have a strong foundational knowledge in technology so they are able to educate new users on how to use the web-based platform. Providing clear verbal instructions can lessen the demands of the mobile screening tool to older adults with aphasia. Understanding how to interpret results, including sensitivity and specificity levels, is vital to being able to recognize false positives. Clinicians should understand that a screening tool is not a full diagnosis. Clinicians must be able to interpret results by considering the patient's medical history and environmental factors, such as potential distractions during telehealth sessions. Clinicians must also recognize when it is appropriate to refer the patient for a comprehensive evaluation.
Clinical implications. The masked administration time is a lot shorter than previous aphasia screening tools, but limitations are as follows. Additional time may be needed to set up the iPad or even give instructions to new mobile device users on how to tap the screen. Example, using finger movements. Having zero initial experience with technology could use up a large chunk of time that could be spent on the actual screening administration. Aphasia patients could also be inattentive due to poor motor impairments. This can cause cognitive overload, which we do not want, as the patients are already undergoing adverse effects. Limitations. Sample size. The study included a relatively small sample of stroke patients, most with left hemisphere lesions. This limits how the findings generalize to a larger, more diverse populations. Individuals with visual deficits, neglect/inattention, hearing loss, illiteracy, and confusion were ruled out. Stroke-only population. Participants all had stroke-related aphasia. The results may not apply to individuals with aphasia due to other injuries or conditions. Technology-related errors. The iPad's touchscreen sometimes misregistered responses. Example, double taps, premature responses, or failure to detect touch. The scoring system does not allow for corrections, which could lower accuracy. Reflection. This study provides strong evidence supporting the reliability, validity, and clinical feasibility of the MAST as a mobile screening tool for stroke-related aphasia. The high agreement with the KFAST, Korean French aphasia screening test. This supports the use of a mobile or telehealth-based screening tool to identify aphasia quickly and accurately. For adults with aphasia, this can improve access to early assessment and faster referrals to speech therapy, especially in rural areas.